Research is revealing what causes the heart to malfunction and how to stop that from happening. The incidence of many heart conditions in wealthy countries is declining. In the United Kingdom, for example, the rates of ischemic heart disease or CHD, myocardial infarction and heart failure have decreased since 2005. The incidence of atrial fibrillation has increased probably because of an aging population. Death rates from coronary heart disease or CHD in the UK have halved since 1980, but CHD is still the commonest cause of death. The decrease since 1980 may be because fewer people now get CHD in the first place or because more people survive after experiencing their first attack or both. What is the reason for the 50% decline in heart disease over the past 30 years in the United States? Models have shown that this remarkable decline of heart disease in the US has been fueled by rapid progress in both prevention and treatment, including precipitous declines in cigarette smoking, improvements in hypertension, treatment and control widespread use of statin to lower circulating cholesterol levels. When you classify modern diseases, one could think of them as congenital, inflammatory, degenerative, neoplastic, autoimmune, and so on. Today, we encompass them as chronic inflammatory diseases, excluding the genetic ones. Science has proven that chronic low-grade inflammatory diseases are silent killers that contribute to cardiovascular diseases, cancer, type 2 diabetes, and they are all modern-day lifestyle diseases acquired to live with, resulting in high morbidity and mortality. How can we fight back and live a healthy, meaningful, and less stressful lifestyle? This talk is all about that. That is to fight back inflammation. Heart disease is considered today as an inflammatory disease and cholesterol is not directly related. That is the accepted theory today. It was thought that coronary artery plaques were caused by high cholesterol levels in your blood and doctors prescribed statins to lower your blood cholesterol level. Researchers now claim that inflammation is the cause of plaques formation in your arteries, leading to blockage and heart attacks, and management need to target that. Inflammation plays a major role in all phases of atherosclerosis, meaning the thickening of arteries. Stable plaques are characterized by chronic inflammatory infiltrate, whereas vulnerable and ruptured plaques are characterized by active inflammation involved in the thinning of the fibrous capsule, predisposing the plaque to rupture. Both blood pressure and high cholesterol, diabetes among others, are major risk factors for heart disease, and inflammation seems to play a key role that causes them. In 2008, the Jupiter study found that for older adults who did not have elevated blood cholesterol but who did have elevated blood levels of inflammatory markers detected by performing C-reactive protein test or CRP, treatment with cholesterol-lowering statins drugs reduced the number of heart attacks and strokes. But it wasn't clear whether that was because statins reduced the inflammation or because they further lowered bad cholesterol, since they do both. We now know that statins have the function of being an anti-inflammatory drug and as such will be beneficial to preventing inflammation even though your cholesterol level is at normal range. Do statins considered as an inflammatory drug, does it do through lowering of blood cholesterol or due to something else is being debated. The advent of statins, medication that lowers LDL by inhibiting the cholesterol producing enzyme in the liver, reinforced the view that LDL cholesterol has a substantial role in heart disease. In the early 1990s, the Scandinavian Simvastatin survival study showed that statin Simvastatin was effective at lowering LDL cholesterol and reducing the risk of a heart attack. Since then, numerous randomized clinical trials have shown that statins reduce heart attacks, strokes, and death. A review in 2016 concluded that every 10,000 people with vascular disease, a daily statin would prevent 1,000 heart attacks, strokes, and coronary artery bypasses. For people to doubt that statins save lives in high-risk patients seems to be just extraordinary in the light of the very strong evidence, says Armitage, an epidemiologist at the University of Oxford, UK. There are risk factors that can lead to inflammation, such as smoking, high blood pressure, LDL cholesterol, and blood sugar levels. Models have shown that this remarkable decline in coronary heart disease has been fueled by rapid progress in both prevention and treatment, including precipitous declines in cigarette smoking, improvements in hypertension treatment and control, widespread use of statins to lower circulating cholesterol levels, and the development and timely use of thrombolysis and stents in acute coronary syndrome to limit or prevent infarction. The link between LDL and heart disease is indisputable, says Jane Armitage, an epidemiologist at the University of Oxford, UK. As evidence, she points to studies of people with familial hypercholesterolemia, a condition that arises from a mutation in the gene encoding the LDL receptor protein. This protein usually removes LDL cholesterol from the blood, but in people with this condition it is faulty. As a result, people with familial hypercholesterolemia have abnormally high levels of LDL cholesterol, and if left untreated are up to 13 times more likely to develop coronary heart disease than someone without the mutation. It was found that middle-aged men with high levels of an inflammatory marker known as C-reactive protein or CRP produced in their liver were at risk of heart attack and stroke, regardless of their blood cholesterol level. Could eating a high-fat diet be a risk factor for inflammation? Shortly after the end of the Second World War, many affluent classes of people in the US had much higher rates of coronary heart disease than did people in post-war Europe. In developing countries like Sri Lanka, heart disease was unknown during or after the war. The commonest fatal disease in Sri Lanka post-war was double pneumonia, and only sulfur drugs were available to combat the infection of the lungs, and those hospitalized for the disease never came home. Ansel Keys, a physiologist, investigated the cause of the high incidence of heart disease in the 50s, and he correlated it to high-fat diets. Keys presented his diet heart hypothesis with gusto at a World Health Organization meeting in 1955. But not everybody agreed. Uffe Ravenskov, a Danish independent researcher based in Lund, Sweden, dismissed the relationship between the dietary fats cholesterol and coronary heart disease, calling it the greatest medical scandal in modern times. Critics such as Remsco say data points in key 7-country study were cherry-picked to fit the conclusions. For instance, Keys did not include data from France where the occurrence of heart disease was comparatively low at the time despite the nation's high-fat diet. This graph reveals the heart deaths correlated with high cholesterol in red, reveals that from 2010 onwards, the cholesterol level was getting less while the heart deaths were rising. The graph obtained from ScienceDirect.com. So the findings are that there is more to a healthy heart diet than cholesterol. As the old adage goes, you are what you eat. If you eat the right foods, you may be able to ward off some inflammation for a long haul. Anti-inflammatory foods are miso, coconut oil, bone broth, rosemary herb, tuna fish, nuts, apples, yogurt, avocado, oysters, garlic, eggs, whole grain, and spinach. Pineapple, chia seeds, tomatoes, extra virgin oil, cherries, broccoli, beets, turmeric, red bell peppers, wild salmon, dark chocolates, green tea, ginger, raw oats. This is from the reference Best Food to Help Fight Inflammation by Jake Schreier, updated on September 14, 2020. Their main sources of health-driven properties are anthocyanins, which can through your body turn off certain genes that cause inflammation and problems with your immune system. They also have a ton of vitamin C, which does hurt in the fight against chronic pain and ailments. Hope this presentation was useful. Stay safe and goodbye for now.